Hello, I'm Bert Oliver, and welcome to Bowie News and Views. And today, John Ross is on a leave of absence, and we have a guest in the studio, Robert Dooley, who is going to give us some information about Medicare and Medicare supplements. He's an expert in that area, so Robert Dooley, welcome.
Hi, thank you. Thanks for having me, Bert.
Pleasure to have you, and there's so much, and the timing is just perfect in this area. And although you and I would probably, you'd be just as comfortable talking about any insurance since you've been with a company for a very, very long time. And you're familiar with this area. You're in Bowie because you went to the University of Maryland and graduated from there.
Correct.
And been in the insurance business almost since that time.
Yeah.
So, Rob, what do you think we should, just tell me we can start about this Medicare Part A. Is that what you, or anything you
Medicare Part A and Part B and supplemental. Bert, what got me interested in Medicare is a lot of areas in health insurance are dwindling because the federal government is taking a look at taking over how some of health insurance is run, and the states are going to get involved. But something that's already been reformed is Medicare and Medicare supplement. And there's an opportunity because of the baby boomer generation. For the next 11 years, 7,000 people every day are going to turn 65 years old. And so that's a lot of people that need to learn about Medicare and how Medicare supplements work. And that's kind of the role I want to play, is to help them understand it better.
Well, that's great. Where do you begin with so much to talk about?
I guess the first area is, what is Medicare, you know, and when did it get formed? It originally came out in the early 60s that there needed to be a way to help seniors pay for the cost of health care, which at the time was starting to go up and now has gone up considerably since the 60s. But the way it works, Bert, is everyone gets Part A of Medicare as who is paid into the Social Security system. And Part A of Medicare really covers hospitals and covers hospice care. And I just brought a handout, if you don't mind.
Sure, that's great.
That shows that what Medicare Part A covers. And Medicare Part A covers everything in the hospital except a deductible. And that deductible this year is $1,100. But next year, it's going to increase to $1,132. And it does that every year. It goes up a little bit. But if a person needed to be in the hospital longer than 60 days, for the first 60 days, the deductible is all a person pays when they're have Medicare Part A. And again, everybody who turns 65 and is paid into Social Security has Medicare Part A. But after that, if they've been in the hospital more than 60 days, they're going to pay this year $275 a day from 61 days to 90 days. And next year, that increases to $283. And so this is why there's a need to have what's called a supplement or a gap insurance to cover what Medicare doesn't pay. It even increases more, that if you needed to be in the hospital more than 91 days, it is $550 per day this year, and next year goes to $566 for every day a person stays in the hospital that they would have to pay.
Well, you're right. A lot of people don't know that.
No, they don't.
So you're letting it. Thank goodness we're getting it out.
Yeah, and so Medicare Part A is really good for how hospitals are covered, but we all know the other big part of it is going to the doctors. And so what covers going to the doctors? Well, that's covered under Medicare Part B. And Medicare Part B has a deductible this year of $150, which, Bert, being in the health industry, I think is low. In the under 65 market with employer health insurance, many employers have a much higher deductible for going to doctors than $150. And in 2011, that's going to $162. So that's not bad. But after you pay that deductible, if you go to a participating Medicare doctor, and about 95% of all doctors participate with Medicare right now, which is great.
Yeah.
There was a little bit of a danger with the Medicare passing of the new health legislation that might go down, because one of the ways they decided was a good way to pay for that cost of the getting everybody health insurance was to ask doctors who see Medicare patients to accept a 20% cut in pay.
Oh.
And that was supposed to go into effect this year. Now, it's come up in front of Congress twice now, and both times it's been decided that this is not a good time to be reducing what doctors get paid. Medicare is already the lowest fee schedule out there.
I see.
So we don't want to, I don't think it's a good thing to try to tell doctors to see Medicare patients and get paid 20% less at this point. And Congress has agreed twice now. It has not been approved. And I don't see where that's going to change anytime soon.
No, I see. Well, you're absolutely right. There are some, I noticed that at doctor's visit, they actually had to sign up, we are accepting Medicare patients.
Right.
Almost like we're doing it now, and we're not doing it before. I don't know whether that was the message they had. That sign's not there last time I was in that doctor's office.
Interesting.
But they do and can. There's no rule of law that says you've got to take this patient or that patient at this point.
Correct.
Is there?
No, there's not.
So it's understandable then that the doctors would not be too happy with their costs going up, like everyone's, yours and mine, on every annual basis. But it costs more to go to the doctor's office now than it did just 2 months ago because gas prices have gone up. So people have to understand that the doctor could, then there could be fewer accept a Medicare patient if it did not give them at least the fair cost. But 20%, that's quite a big amount.
Bert, it's a big amount when you know that right now, if you're under 65 and you're on an employer group plan, doctors are getting paid about 20% more than the current Medicare fee schedule for seeing somebody under 65. So when they see somebody over 65, they're already getting a 20% less than what they would get if they saw somebody on a group plan. So to ask them to take another 20% cut in that, I think is, at this time, just not a good decision. And you're right, Bert, it would cause more doctors to drop out of seeing Medicare patients, which is not a good thing.
Yeah, and personal experience I have going to the same doctor after not going to one for 12, 15 years, going to the same one since then from the group plan into the Medicare, and there was no change at all in our visit and my care. So the doctors have always been very professional about that, and there are some people that will hopefully have the opportunity to do that when they retire, and they want the same kind of service they get with their regular group plan. Have you noticed any actual attitudes, you might say, of the physicians about uncertainty about the new health plan?
Yeah, quite a bit. There's a tremendous amount of uncertainty right now, and part of that means the doctors are concerned of what they're going to be paid, and to the point where some doctors who have had their dads were doctors and now they're doctors, and their sons and daughters might become doctors, are even advising their sons and daughters that they might want to look at a different profession, and that's a bad thing. But the reason is that if the federal government starts telling doctors what they are going to get paid for everything, it'll get to the point where they'll be paid like a school teacher or some other civil servant, and that's not why the brightest and the best go to become doctors.
Yeah, that would make sense. But with there's already a lot of information you've given us on the Medicare plans, and is there any changes you expect other than what you've mentioned?
One of the things that has just happened here in 2010 was the modernization of the Medicare Act, and what that meant is previously, the federal government has approved certain plans to be offered as supplemental plans, or what is known as Medigap plans, that covers what Medicare doesn't pay. I just showed you that there's a fair amount Medicare does pay, but there is also a fair amount they don't pay. The Medigap plans were designed and approved by the federal government to assist where a senior wouldn't have to pay a lot out of pocket, especially if they went into a hospital or had major need to visit the doctor a lot. So what was developed was Medicare supplement. And what just happened was, in the modernization, it's changed a little bit, that there wasn't a need for some of the plans because they were redundant. They covered the same things other plans covered. So they cut out a few plans and they added 2 new plans, one of which I'm real excited about, which is Plan N, like in Nancy. The new Plan N makes it so people are used to paying $20 when they go to the doctors. If you're in a group plan through your employer, you probably have a copay, and that's usually $10 or $20 to go see a doctor. Well, now that's being added with this new Plan N. There's an excellent plan, and the plan that most people are on who buy a Medicare supplement is Plan F, like in Frank. Plan F is a tremendous plan, because if you go into the hospital or you go to a doctor, everything that Medicare does not pay is paid by Plan F, which means you pay nothing, okay? But the premiums to buy, which are a little higher because you're buying a plan that when you go to the hospital or doctor, you can have peace of mind that you're not going to have to pay anything out of pocket for doctors and hospitals. The new Plan N is different in the fact that it puts back $20 copays, plus you, the person, would be responsible for the deductible. And again, I said the deductible is going up from $155 this year to $162. If you were part of a group plan, you're used to having a much higher deductible right now than that. So Plan N is, I think, a very good compromise because it puts deductibles and copays back in there. And it comes from one particular carrier, Mutual of Omaha, with a 30% reduction in premiums, which is considerable because seniors are on fixed incomes and they need to save money just like everybody else does in these hard economic times we've been having.
Sure. Well, so how long has that program been available?
June 1st of this year was the first that Plan N came about. I have an example, if you don't mind.
Please.
I'd like to show the example. First, I want to just talk about perception of people. You know, everybody likes a brand name when they go to buy something. And the big brand names out there in Medicare supplement are Blue Cross Blue Shield and AARP. AARP offers a Medicare supplement plan. And with that, you think if you're in the under 65, you think that gives you more, it gives you something more. And it does in the under 65 because usually Blue Cross Blue Shield and some of the bigger carriers have bigger doctor networks. So by joining them, more doctors accept them as payment in full. Well, what I just told you is with Medicare, that's not true, because if you agree to see a Medicare patient, which means you're participating no matter what insurance company sells you the Medigap policy.
Right.
And so it doesn't change. The network of doctors do not change from one carrier to the next carrier. So if the networks don't change and the plan designs are set by the federal government, so Plan F from Care First is exactly the same as Plan F from Mutual of Omaha or AARP or whoever the Medicare supplement is. If that's true too, then really cost matters. You know,
Absolutely.
It's the number one thing. If the doctor network's the same and the network's the same, then the next biggest thing that you care about is the cost.
Right.
And so I just brought an example here today. If you went with Blue Cross Blue Shield, which in this area is Care First in Maryland and here in Bowie, and you were 70-year-old male, Plan F would cost you $192.50 a month. Again, that's not too bad, Bert, but if it's this is for an individual. So if it's you and your wife, that means you have $292.50, and that starts to add up. And so if you went with another carrier for the exact same product, and I looked at Mutual of Omaha, that same Plan F would be $169.29. So right there, you're saving about $30 by going with a different carrier for the same doctor network, the same plan design. But I'm also recommending that Plan N, like in Nancy, with these copays, might be a good option for many seniors, because Plan N is $124.93. So from $169 down to $124. Now, there needs to be you need to look at your own personal circumstance to see, does that make sense? And that is, how often do you go to the doctors? If you go to the doctors a lot, then it might make sense to buy the more expensive plan, because you're not paying for any copays, you're not paying for any deductible. I brought two examples here.
Okay.
Example number one, if you're a person who goes to the doctor 4 times a year, so once every quarter you go visit a doctor, with Plan N, because you pay less in premiums, your annualized premiums would be $1,499. If you went with Plan F, your premiums would be $2,031. But with that $2,031, you don't pay anything when you go to the doctors. All right, so now if you went to the doctors 4 times, you would be paying the $162 deductible, and then you would also be paying the $20 office copay every time you go to the doctor. So with this example, your premiums would be $1,741. The next example is a person who goes to the doctor considerably more, goes to the doctor once a month, and so 12 times a year is going to the doctors. With this example, the total cost of the plan would be $1,901. This is still a better plan for that, even that person who goes once a month. I've looked at where's break even, where Plan F becomes a better plan, and it's about 20 visits a year. If you go to the doctor more than 20 times a year.
If you don't mind, we'll leave that up there just for a moment, make a reference to it. And if, I guess, we've got to give some information at the end of the show about where viewers can contact you and get specific information. But I guess you've made a good point there. And a lot of people go to the doctor regularly. They predict that their own because of their experience. But does the doctor have a minimum? In other words, if he said, see you next month, that may have been something 10 years ago. If they say, see you in 4 months, is any of that strategy going on now, or is it just what the physician thinks?
It really is just what the physician thinks.
Okay, so Medicare customer or patient, and they're doesn't say, Medicare doesn't tell a doctor, look, we'll only pay every 4 months checkups.
And Bert, you'll find this interesting, and it just kind of makes a little bit of sense. In Minnesota, there's been studies done on this, and in places like Minnesota, where many people who are getting up in years live with their children in more rural parts of the country, and they tend to go to the doctors less because they have somebody to talk to about their their aches and pains and their issues.
Right.
And therefore they go to the doctors less. Then a person who's maybe moved down to Florida. So now they're down in Florida and they're living there. The study shows that the cost of somebody for health care living in Florida is 3 times the cost of somebody in Minnesota. Wow. It's not because that person's less healthy, Bert. It's because they just go to the doctors more. It's more of a social outing. To go to the doctors, and, and it drives up the cost.
Yeah, that is, and it's typically what the results are is that, not just because the weather's different or whatever. First thing I would think of is maybe going to Florida, you have less visits if it were the weather.
Right.
But maybe less visits in Minnesota would be because
Too cold.
you don't want to get out in the cold. Like we're having in the Maryland area last couple of days. It's enough to really wonder how the people far north of where we are, the problem they're having. If it's so brisk and having to put on a heavy coat here, but how is this 2 or 3 states north? You know, Rob, we're about in our last 5 to 10 minutes, and you know, I think if there's any more you can illustrate, or we'll run through the high points again, because I think this information is not. It's accessible by mail. I will advise everybody, and you get so much of it.
Right.
You
Get
know,
overwhelmed sometimes.
Yeah, and some kind of duplication too.
Right.
I don't know how that happens, and with the price of postage, but I'm getting duplicate mails, my wife and I, and the programs are constantly contacts with you by phone and so forth. But the problem I have with it seems like that it's easier to understand what you just said than to try to sit and compare different plans. And I think in one company, they're even competing with each other because I'm getting 2 mailings from them.
Right.
And maybe the spelling is wrong. But that's one thing that I've felt that I wanted to have you here for, is because a lot of people I talk to, they'll say, well, I just get so much mail that's confusing. And after a while, I get a little impatient with it and don't even open it.
Right.
And that's not good, but the important thing is there's so much information available, not only by mail, but by contact. But it seemed like you've broken it down a little better than I've seen it before. And so we might want to just go from the top to bottom.
Here's
briefly.
one of the key things, and that is when you turn 65, you get what's called open enrollment 3 months before you turn 65 and 3 months after your 61st birthday, where you can purchase any of these plans, guaranteed issue, no medical questions asked. And that's a good time to purchase them. It's also the time where you would sign up for Part B. Part B is optional, but you have to have Part B in order to get a Medicare supplement plan. Part B is a deduction out of your Social Security check, and this year it's going to be $115 a month for Part B. Last year it was $110 a month for Part B. But after that, and you take a Medicare supplement, one of the issues is to move from one company to another company, they can underwrite you. And if you have an ongoing medical issue, and many seniors do, this underwriting can keep you from being able to move. One of the things I like about the new Plan N with some of the carriers is it's guaranteed issue all the time. So it's less costly and it's guaranteed issue. You can't be turned down even if you have a pre-existing medical condition like cancer or a heart issue or whatever. You're guaranteed to get that insurance at that price, and you cannot be turned down with Plan N, and that's from some of the carriers. And so that's a big thing to tell seniors, that they can get that. The other thing that I think it's important to know is that this is good insurance. I think a lot of people worry that when they turn 65 and they get off a group plan, they're not going to have good insurance. They're going to have something that's less, and doctors or hospitals won't see them. That's not true. It's very good insurance, and 95% of all doctors accept Medicare and see Medicare patients. So those are important things. The one thing I haven't talked about is the new prescription drug Part D, and that's very important to seniors, of course. Many seniors are on many prescriptions, and it's important to look at getting a Part D when you turn 65 or you come off of a group plan.
Explain that a little more. We got enough time.
Yeah, okay.
On the prescription plan.
It came about 2 years ago. Medicare supplements, for the most part, did not cover prescriptions. And so the federal government and Congress started a new program under the Bush administration called Part D, like in David. And Part D covers prescriptions. You pay a copay or a small deductible, and they're covered up to $2,850. But after that, the cost of prescriptions reach that, you go what's into and then known as the donut hole. The donut hole is what's not covered, and it's around $4,450 worth of prescriptions, which is a lot. And there's been movement with this new legislation in health insurance to start closing the donut hole for people who take a lot of prescriptions. And this year, it's $250 towards that $4,400. It's not much. But starting in 2011, all the major manufacturers of brand name drugs have agreed to provide prescriptions to seniors that go into the donut hole at a 50% reduced cost.
Oh, that's
And
great.
that starts in 2011. Yes, it's very good.
Great news. If you look at some of the prescription costs on, I don't know what to call all of them, but it's not generic.
No.
And there's some $300 or $400 on some 30-day supply.
It is, and Bert, and one of the key things I would recommend to seniors, and I do recommend to seniors, is let's say you've been told you need a 20 milligram pill of Lipitor, okay, which is for cholesterol. And that 20 milligram pill could be close to $150 a month.
Right.
Well, if you ask your doctor for a 40 milligram pill, the cost is $140 or $50 a month. The same cost for the 20 milligram pill, the exact same cost. And if you get yourself a pill splitter, which it's easy to do, you literally can have 2 months worth of a prescription for one month's supply. And if you want to check out these costs, drugstore.com is a good location to check out the cost of drugs.
Drugstore.com.
Internet site.
I'll do that, and I hope our viewers will too. And that is very important. You know, Rod, that's a nice tip. Personally, I got something out of that.
Yeah.
Because I'm looking at those prescription prices for my wife and I, mostly. And they are, in spite of having insurance, there's certain things that they don't cover.
Right.
Or they'll cover it, but you pay it for it all. I mean, it's still, and it's so much confusion there. And when I talk about getting stuff in the mail, by all means, keep it and read it. I'm not trying to encourage it because of it's any drug information. But in addition to that, we're going to wrap up now.
Okay.
In addition to that, we're going to get your phone number and maybe have a reference if you don't mind.
That'd be great.
And we'll add to the end of the program. And you've done so well on this. I think we'll try to play it more than a 5-day period.
Okay.
I think it may be a second 5-day period because the timing too, it's a season for some decision to be made.
It is, yes.
And next time we meet, we may talk about business insurance,
All right.
business health. Thanks, Rob, for being here.
Thank you, Bert. Thanks for having me.
Thanks a lot for viewing.
Thank
See
you.
you in the next program.